Let's begin with cardiology and heart surgery, an area where innovation literally saves millions of lives. Heart disease remains the #1 cause of death in America, so leadership here matters. The #1 hospital in this field is NYU Langone Hospitals in New York. Over the past decade, NYU Langone has poured resources into building state-of-the-art cardiac catheterization labs, robotic surgery suites, and advanced transplant programs. What sets them apart is not just survival rates, but the speed with which patients get into the right treatment pathway. A patient with a blocked artery in Manhattan may find themselves in surgery within hours at NYU, with outcomes rivaling the very best globally. Coming in second is Mount Sinai Hospital, another New York powerhouse. Mount Sinai pioneered several minimally invasive techniques, like transcatheter aortic valve replacement, giving hope to patients who were once considered too fragile for surgery. At number 3, Cleveland Clinic has been a global leader in cardiology for decades. Even though it no longer holds the very top spot, its heart program continues to handle one of the largest case volumes in the world, particularly for bypass surgeries and advanced heart failure care. In fourth place, the Mayo Clinic in Rochester, Minnesota, brings its legendary patient-first philosophy to cardiovascular medicine. Mayo's strength is integration. Cardiologists, surgeons, and imaging specialists collaborate seamlessly. Rounding out the top 5 is New York Presbyterian Hospital, Columbia and Cornell, which is especially strong in complex congenital heart cases and advanced surgical training. These 5 hospitals together represent the cutting edge of cardiac care, and their competition with one another drives innovation that benefits patients nationwide. Now, let's shift to diabetes and endocrinology, a specialty that affects tens of millions of Americans living with diabetes, thyroid disease, osteoporosis, and hormonal disorders. At number 1, Mayo Clinic Rochester again sets the standard. Here, endocrinologists have access to some of the most advanced labs in the world, and patients are often enrolled in cutting-edge clinical trials for new diabetes technologies like continuous glucose monitors and hybrid closed-loop insulin pumps. New York Presbyterian, Columbia and Cornell holds the number 2 position, excelling in adrenal and pituitary surgery as well as diabetes management in pregnancy. In third, Brigham and Women's Hospital in Boston has a long tradition of endocrine research, particularly in women's health and osteoporosis. Fourth place belongs to NYU Langone Hospitals, which has built a comprehensive diabetes center that not only treats but educates patients and families. Finally, UCLA Medical Center in Los Angeles takes the 5th spot, known for innovative treatments in both type 1 and type 2 diabetes. These hospitals are not only treating patients today, they are setting the standards for how metabolic diseases will be managed tomorrow. Moving to the digestive system, gastroenterology and GI surgery is an area where outcomes are measured in the ability to detect cancers early, to repair digestive tracts after trauma, and to give people back their quality of life. The Mayo Clinic Rochester once again leads the nation, with its specialists in colon cancer surgery and liver transplantation. Cedars-Sinai Medical Center in Los Angeles, ranked 2nd, is especially famous for treating inflammatory bowel disease, with one of the largest IBD research centers in the world. Cleveland Clinic takes 3rd, known for innovative endoscopic techniques that reduce the need for open surgery. In 4th, NYU Langone Hospitals deliver outstanding results in GI cancers and advanced surgery for reflux disease. And at 5th, Mount Sinai Hospital in New York remains a center for liver disease treatment, especially hepatitis and cirrhosis. What makes these institutions remarkable is how they combine surgery, research, and patient support programs, ensuring not just survival, but long-term quality of life. When it comes to the brain and nervous system, the stakes couldn't be higher. Neurology and neurosurgery covers everything from stroke and epilepsy to brain tumors and spinal cord injuries. At the very top, once again, is NYU Langone Hospitals, recognized for both clinical excellence and pioneering research. Imagine a patient suffering from uncontrollable seizures. NYU's Epilepsy Center offers surgical and non-surgical solutions that have changed lives. UCSF Medical Center in San Francisco ranks second, with groundbreaking work in brain cancer and neurodegenerative diseases like ALS and Parkinson's. New York Presbyterian Columbia and Cornell stands in third place, known for its comprehensive stroke program and deep research connections with Ivy League universities. In fourth, Mayo Clinic Rochester continues to set benchmarks for spinal surgery outcomes and multiple sclerosis care. Fifth place goes to Rush University Medical Center in Chicago, which has quietly built one of the most respected neurology departments in the Midwest. These hospitals demonstrate how science and compassion intersect when dealing with the most delicate organ of all, the human brain. Another field that has grown in importance is psychiatry, reflecting the rising awareness of mental health in America. Massachusetts General Hospital in Boston holds the #1 spot, a leader in everything from depression and anxiety treatment to pioneering work in psychopharmacology. Close by, McLean Hospital, also in Massachusetts, is second, long considered one of the top psychiatric hospitals in the world, with deep expertise in bipolar disorder and addiction. Third is New York Presbyterian Columbia and Cornell, whose psychiatry program spans both inpatient crisis care and outpatient therapy. Johns Hopkins Hospital in Baltimore ranks fourth, continuing its long legacy of groundbreaking psychiatric research. Fifth is the Resnick Neuropsychiatric Hospital at UCLA, which integrates advanced neuroscience into psychiatric care. Sixth and seventh go to Yale New Haven Hospital and UPMC Western Psychiatric Hospital, respectively, both making strong contributions to the field. These hospitals remind us that mental health deserves the same attention as physical health, and their work is dismantling the stigma surrounding psychiatric care. Finally, let's breathe a little deeper and look at pulmonology and lung surgery. In 2025-26, NYU Langone hospitals lead again, demonstrating excellence in lung transplants, minimally invasive thoracic surgery, and chronic lung disease management. Mayo Clinic Rochester ranks second, particularly strong in treating COPD and interstitial lung disease. Third place goes to UCSF Medical Center, which has made major advances in lung cancer therapies. Fourth is UCLA Medical Center, a leader in cystic fibrosis and pulmonary hypertension care. Fifth place belongs to Cedars-Sinai Medical Center, recognized for advanced robotic lung surgery. These hospitals have become beacons of hope for patients facing some of the toughest diagnoses, including late-stage lung cancers. So, what does this year's Best Hospitals report really tell us? First, that excellence is concentrated but not monopolized. NYU Langone hospitals appear at or near the top across multiple specialties, demonstrating remarkable breadth. Mayo Clinic Rochester remains synonymous with quality, ranking first or second in several key fields. Cleveland Clinic, Mount Sinai, Cedars-Sinai, UCSF, and Johns Hopkins all continue to excel, reinforcing their international reputations. Second, it shows that patient care is not just about survival rates, it's about the combination of safety, innovation, access, and compassion. These hospitals are not simply places where medicine is practiced, they are hubs where science, humanity, and technology converge to push healthcare forward. And finally, perhaps the most important lesson, rankings are a guide, not a prescription. The best hospital in America may not be the best hospital for you. Your choice should take into account your specific condition, your insurance, your location, and your doctor's advice. Use the US News rankings as a starting point, then have an open conversation with your healthcare team. Because in the end, the #1 hospital is not always the one with the #1 trophy. It's the one where you and your loved ones find the best chance at healing.